HIV. What's the first thing that comes into your mind when you hear these three letters? Is it contagious? Is it deadly? Is it sex? There are many myths that are revolving around HIV and AIDS. I'm Dr. Stephen Lee. In this video, I'm going to debunk some myths about HIV and AIDS and to provide a better overview about HIV and AIDS to all of you. So without further ado, let's get started. Myth number 1. HIV equals to AIDS. First of all, let us have a look at the word HIV. It stands for Human Immunodeficiency Virus, which means it is a virus that attacks the human immune system. Specifically, they attack a special cell in the body called the T cell, and T cell is one of the lymphocytes in the body, and lymphocyte is a white blood cell. In fact, it is one of the most powerful white blood cells in the body that trigger immune response. If the lymphocytes are attacked by the HIV, their number will start to drop, and the immune response will be less active, and also the body will be vulnerable towards secondary infection. The point when the body's T cell count is so low that the body is susceptible towards diseases that normal immunocompetent person will not get is called AIDS. AIDS stands for Acquired Immunodeficiency Syndrome, happens when the body's lymphocyte or the T cell count drop below certain threshold and the body is vulnerable towards secondary infection. This group of patients, they will get some diseases that normal people with normal intact immune system not get. So it takes 8 to 10 years for a HIV patient to progress into AIDS, which means it takes about 8 to 10 years time for the HIV to successfully weaken the body's immune system. In this 8 to 10 years time, normally the body will be no symptoms, but the patient is still contagious and is able to spread the virus. You have to understand that HIV and AIDS are two different entities. Not all HIV patients are AIDS patients. AIDS can be said as the end stage of an HIV infection, is at the end of the spectrum. So a HIV patient can only be a HIV patient and not progress to AIDS. Myth number 2. HIV is a death sentence. People thought that getting HIV means that they are going to die in another 8 to 10 years time. With the advancement of medical technology, this is not true. Nowadays, we have a type of medication called HAART, which stands for Highly Active Antiretroviral Therapy. This group of medications are able to prevent progression of a HIV patient to become AIDS. So, these highly active antiretroviral therapy do have side effects. But if a patient is compliant to this therapy daily, then their life expectancy will be exactly the same as a normal person. In conclusion, HIV has no cure, but with proper compliance to the medications, their life expectancy is actually the same as normal people. It is a chronic illness, and it is not a disease that should be stigmatized. Remember, they are also human beings and they are patients as well. They do have their own sufferings. So avoid having unnecessary stigma on this group of patients, because this stigma will actually delay the case detection, which means they will prolong their time to get tested and also prolong the time they receive treatment. Myth number 3. HIV is highly contagious. Some people think that HIV can be easily transmitted through casual contact For example, sharing utensils, for example, hugging, for example, kissing on the cheek. You have to understand, HIV is not as contagious as you think. Globally, the most common way of transmitting HIV is through sexual contact, followed by parenteral route, which means through bloodstream. Here we have a few branches. It can be through intravenous drug usage, it can be through blood transfusion, it can be through needle stick injury. The third route is actually from mother to child, which can be across the placenta or through breastfeeding. The most common route of transmission, as I said earlier, is sexual contact. But there are many things that we can talk about when we talk about sexual contact in terms of HIV transmission. When it comes to sexual contact, you have to understand whether the sexual exposure is protective or not protective, which means is there condom usage involvement. Studies have shown that condom usage can successfully reduce significantly the risk of transmitting HIV. Second thing is you have to understand what kind of sexual activity the person is involving. A lot of studies also show that oral sex has negligible risk of transmitting HIV. For vaginal intercourse, it depends on whether it is the female or the male. The male has a risk of about 0.05%, whereas the female has the risk of about 0.1% due to a larger contact area for the female sexual organ. The highest risk in terms of sexual activity is anal sex or anal intercourse, whereas the receptive end has a risk of about 0.5%. One more thing, if the patient is on HAART that I said earlier, and the viral load, which means the amount of virus in the blood, is undetectable, then the risk of transmitting HIV is also negligible. So, in other words, HIV does transmit through sex, but there are a few factors that we can think about and we have to consider. Firstly, HIV can only be transmitted if one of the partners is having HIV. And secondly, it also has to depend on the viral load if, let's say, one of the partners is having HIV. Thirdly, it also depends whether the sexual contact is protective or not protective. And number 4, it also has to depend on what kind of sexual activity that the person is involving into. HIV does not discriminate between race, gender, status, sexual orientation, or occupation. To prevent from getting HIV, the best way is to avoid from committing high-risk activities. So do understand that HIV patients do require help and support, and we do not have the right to judge what they have done or what they have experienced. So we can only share our love and care to this group of people who need our help. So let's show love and respect to this group of patients. Thank you. I'm Dr. Stephen Lee. If you like my videos, do subscribe to my channel. I will see you again in my next video.